Hello and good afternoon, everyone. I hope you're all doing very well and happy and adjusted well. I hope you've been having a good week. I've been out for the first couple of days this week, but I'm back now, and I have a safety training, or it's really kind of a safety update on where Vistability is on staff getting vaccinated. So I figure as long as I get it, then it should go out to you as well. And I can only read you part of it because some of it is it's confidential for staff members. I mean, it doesn't mention anybody's names, but it's still kind of confidential. But there's some of the information in there that I'm sure is very relevant and pertinent to you. And so I'm going to let you know exactly what that information is and make sure that you're all up to date and happy with the information that we get. Okay. So this came out on October 8th, and it's for all the staff members. And, in some ways, and I will find out more information, but for people who work at the park and things like that, I'm going to find out, because technically you work for Vistability, you get our paycheck through us, it has our name on it. So I'm going to see if this affects you and working and things like that in terms of vaccination, but I don't know yet. So I'll just read the parts that are most important to you and affect you and that you should know about for what we're doing moving forward. Okay, so it's about a vaccine mandate. So on September 28th, 2021, both California's Department of Public Health and the Department of Developmental Services published health orders for vaccine mandates for all employees of regional centers and vendored programs, that's us, of the Regional Center for Children and Adults. So this does apply to everybody who works, all the staff who work here, because we are a vendored program. And this is in quotes, this part. All must have the first dose of a 1-dose regimen or the second dose of a 2-dose regimen by November 30th, 2021. So everybody has to have at least, depending on the vaccine that you're getting, of course, has to have at least their first dose by November 30th, 2021. Because it's exactly 2 weeks after you get your first shot that you go and get your second dosage shot. The health order explains that the Delta variant of COVID-19 is highly transmissible and causes more severe illness, as the current case rates are 10 times higher than they were in June of 2021. In addition, vaccinations are the most effective way to prevent the infection, transmission, and outbreaks. So that is what this health order is, and so each company, kind of like Panera Bread, anybody can say, hey, and really this also comes from Cal OSHA. It's happening where my wife works as well, because they're considered essential agricultural workers, and they all have to be vaccinated as well. And so it's affecting it. It's becoming mandated for certain places, to get vaccinated. So therefore, because the vaccine is so important, therefore these measures can improve vaccination rates in these settings, which ensures that both the individuals being served as well as the workers providing services are protected from COVID-19. So for more than 85% of staff where we work, this new mandate has little or no impact, because at least 85% of people have already been vaccinated with one of the 3 shots, be it Pfizer, Moderna, or the Johnson & Johnson. There are chances that you can plan an exemption to getting this. So, sorry. So it says so you may, and this is an important part, a staff member may request an exemption to this mandate for one of two reasons. Number one, due to qualifying medical reasons as determined by a licensed medical professional, or two, due to strongly held religious beliefs. So the first one, as we've discussed before, there are some people that are actually, it is safer for them to not get the vaccine. Very, 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 very small percentage. But there are some people that getting the vaccine could actually result in worse than getting COVID. In fact, it could result in the person's death. And so that is something. But again, like I said, it's a very, 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 very small percentage. And so, but if that is such for the person, then they're still going to have to get a note from a doctor, and then saying that this is the case, and then they will be exempt from having to be vaccinated because again, I don't want anybody to get sicker or anything like that. That's the whole point of this. And then the second part is due to strongly held religious beliefs. There are some religions that don't believe in vaccination and have scripture that says that they shouldn't get vaccinated, that it's, their body's a temple. There's all sorts of different ones. But, there are honestly, right now, I looked it up last night, and there are really only two groups. I can't remember their names right now. There's like a Christian Science group and also like a Dutch religious group that they don't believe in vaccinations. But really, it's only two. Every other religion, Christian or otherwise, really are fine with getting vaccinations. If they believe that it's important to help your community, it's important to keep yourself safe, and your neighbors should be important to you. And loving one another is something that that most religions strive for, and so making sure that you're keeping people safe and yourself safe, it's all right with most religions. Like I said, there are only two, but if people do, again, they can file for an exemption, and if it's fervent in their belief system, and there are a lot of people who, like with say Muhammad Ali, when he got banned from from boxing, it was because of religious beliefs. He believed that he didn't need to go over and fight in Vietnam. And so he said, I'm not going to do that. I'm not going to kill people in another country that I don't know. It's against my personal beliefs or my religious beliefs. It has to be a religious belief, not personal. And then, but there were repercussions for him. He got kicked out of boxing for a long time, and then resumed his boxing career and still had a great boxing career, but lost a lot of good years. But, that was a strong belief that he held. So, it's understandable, and we need to understand. Now, for those who may be exempt from this, we want to support that, but we also need to ensure the safety of everyone else. So they will also be the people, if they are exempt from getting the vaccine, especially, for either of these reasons, they'll have to wear an N95 mask as well as be tested weekly, just to make sure, because again, the safety of everyone is very important. And then once we reach herd immunity, then things should be just fine. Then, they won't, I don't think they're going to have to wear the masks or be tested weekly at that point anymore. But that's a little while off, because this is a pretty serious mandate. So, and then that's pretty much it. It says we are hopeful for that increasing our community vaccination levels will go far in reducing the incidence of COVID-19 in our community and lead to our ability to reopen our services fully. And that's what we're trying to get back to, is fully coming back to program And, you know, the more people to get vaccinated, if we can take that 85% and get it up to pretty much 100%, that's fantastic. More people can go out, we can do more things. So, if you have any questions, of course, feel free to ask. I'm always here to answer questions, and anything like that. But anybody can really answer your questions, you know. So if for some reason you don't feel like coming to me to ask a question, you know, feel free to call the office. You can ask for anybody there that you know and trust that can give you answers and let you know how things are going. Anyway, so this has been an update of COVID-19 vaccine mandates. I hope all is well, and I hope to see you again soon, each and every one of you. Okay, bye for now.